Symptoms and effects of high blood pressure. Coming to the symptoms of high blood pressure, an individual with hypertension may not see any symptoms or manifestations, and it is regularly called the quiet executioner. A lot of people with hypertension have no signs or side effects, regardless of whether pressure readings achieve perilously abnormal states. A couple of individuals with hypertension may have cerebral pains, shortness of breath or nosebleeds, however these signs and manifestations aren't particular and for the most part don't happen until the point when hypertension has come to a serious or hazardous stage. While undetected, it can make harm the cardiovascular framework and inward organs, for example, the kidneys. Frequently checking your circulatory strain is crucial, as that will more often than not be no side effects to make you mindful of the condition. Hypertension causes perspiring, tension, resting issues, and becoming flushed. In the event that pressure reaches the level of a hypertensive emergency, a man may encounter cerebral pains and nosebleeds. On the off chance that your circulatory strain is too high, it puts additional strain on your veins, heart and different organs, for example, the cerebrum, kidneys and eyes. Steady hypertension can build your danger of various genuine and conceivably hazardous conditions, for example, heart attacks and various other heart diseases. Strokes leading to heart failure. Kidney-related diseases. In the long run, it can eventually result in the narrowing of the primary blood vessels, and may cause damages to brain and eyes. 3 Exercise to treat high blood pressure. 1. Aerobic exercises. High-impact movement can be a powerful method to control hypertension. Yet, adaptability and fortifying activities, for example, lifting weights, are additional parts of a general wellness design program. You don't have to invest hours in the exercise center each day to profit by vigorous movement. Just adding moderate physical exercises to your day-by-day routine will help. Any physical action that builds your heart and breathing rates is viewed as moderate to high-impact movement, including walking and jogging daily, riding bicycles often, skating, swimming and rowing, walking up and down the stairs whenever possible. This also refers to using stairs rather than lifts or elevators. Playing sports like basketball, etc. Go for no less than 30 minutes of vigorous action most long periods of the week. A great many people with hypertension ought to have the capacity to expand their physical action levels securely. It is intriguing to take note of that the vast majority of the bringing down of systolic and diastolic circulatory strain in those with hypertension happens inside half a month of predictable high-impact training.
The correct component how oxygen-consuming activity brings down hypertension is indistinct. Anyway, it is hypothesized that biochemical, neural and hormonal changes in the vein dividers initiate an intense and long-haul vein unwinding.
2. Strength training. Strength training, or in other words referred to as the weight training, can cause a brief increment in pulse amid workout. This expansion can be sensational, contingent upon how much weight you lift. Be that as it may, weightlifting can likewise have long-haul advantages to circulatory strain that exceed the danger of an impermanent spike for a great many people. Also, it can enhance different parts of cardiovascular well-being that can lessen by and large cardiovascular issues. Having doing strength training activities on a regular basis, it assembles solid muscles that assist one to consume more calories for the duration of the day. It's likewise useful for your joints and bones. If you already have hypertension, get your specialist's okay before adding weight-preparing activities to your fitness schedule. 3. Stretching. Similarly, stretching makes you more adaptable, causes you to move better and counteracts damage. Medical specialists suggest that patients with hypertension take part in 30 minutes of direct, dynamic, aerobic activity. This can incorporate strolling, running, cycling, or swimming on 5 to 7 long periods of the week. In any case, if your blood pressure is generally high, your specialist or attendant may like to bring down it with prescriptions before beginning you on an activity program. To know more about lower high blood pressure with exercise, click on the link given below this video in the description.